Morning, everyone. Welcome to today's edition of AM Minnesota. We're going to get our kind of education on today's show about adolescent depression. It is not a topic that we, talk about that often. Probably should talk about it more often, to be quite honest. We want to become educated on it today. May is Mental Health Awareness Month, and as we've done for, I don't know, a couple thousand years. Right, Eric?
It's been a while, Gordy, that we've been doing it, yep.
We've been visiting with Eric Lundin, a psychologist with Rice County Public Health, right?
With social services, yeah. Rice County Social Services.
Social services.
Yep.
Not public health. They're two different departments.
Two different departments.
So you're with the social services department. It's very, in all honesty, a sad topic to discuss. But don't you think we ought to talk about it?
Well, you were actually the person that made me think we needed to do it. For the last 3 years, I've been coming in here. You said, when are we doing something on youth? And I said, next year. And this is the year. We're doing it this year. We're going to talk about adolescent depression and suicide.
And you just had a presentation at New Prague Schools on this topic.
Yeah. And so I thought, perfect timing. I can come in and I'm all refreshed on the information. Kind of come in and give an overview of what I learned and what I was able to give the New Prague teachers.
Which is interesting because New Prague isn't even in Rice County.
Nope, but I was able to help them out.
That's good.
Yeah.
So do you do talks in schools in our county too?
I haven't had that opportunity for a while yet, no. But when the need arises, then I'm there to help them out.
Were the kids attentive?
I did it for the teachers, not the the students, right? The teachers.
How'd that go? Were they attentive?
They were very good students. Yes, they were.
Asked a lot of good questions?
Yeah, they did. Yep. Yeah, they asked a lot of questions.
Top concern was?
Well, when I would bring up the issue of whether we actually ask the S question, people are afraid to ask the S question is, are you suicidal? The teachers were concerned that maybe parents would be angry at them or upset. And I suggested otherwise, that if a teacher is seeing some distress on the part of the student, they should go ahead and ask the S question. Are you thinking of killing yourself? Are you suicidal? Do you feel like dying? These kinds of questions can lead to an intervention that will help the child get the help that they need.
And you'll find in most adolescents, they're blatantly honest, right? They're not going to shield their feelings. If you ask them point blank
I think most people will, if they're suicidal, and you ask them the question, they will tell you whether they're suicidal. Now, the biggest myth around that is that people often think that if you ask this question, you increase the risk of suicide. This is not true. You actually reduce the risk because the kids or adults will often feel relief that someone is actually bringing it up.
Then they got to take action, though.
Then you have to take action. And oftentimes with people who are mental health first aiders, such as any caring adult for its child or adolescent, is to then, get in touch with the emergency room, or if they said yes to that, or to a psychologist or a minister or somebody else who then can take over and get them to a safe place.
Would you recommend telling the parents?
Absolutely. At that point, yes, you're telling the parents immediately, and getting school counselors involved or whatever it is that needs to happen to get them the medical help they need.
But something has to happen now. You can't delay.
Right away. Yep.
It
Absolutely
is,
right.
At that point, it is an emergency.
It is an emergency if they say, yes, I'm suicidal. Mm-hmm.
Yeah. It's a tough topic, but we're going to discuss about it some more. We'll get some more details about symptoms that people might see. It might be your grandchild.
Exactly. It could be, yeah. Grandparents are a great resource for mental health first aid and recognizing signs and symptoms.
So we'll touch on that when AM Minnesota continues. And we are talking today about adolescent depression. I guess the first thing we want to do is define depression.
Well, depression is there's a lot of signs and symptoms of depression. Mostly, persistent sadness, and a big one for kids, irritability. There's an irritability that's sort of a constant there, that's often there. Their sleep is affected. They might have poor energy. They don't enjoy the same hobbies they used to do. Difficulty with concentration. Often a feeling of worthlessness and ineffectiveness. And then another thing that's very common in adolescents and children, somatic pain. Headaches, back pain, and other kinds of stomach pain, these kinds of chronic pain that just, there's not an answer to why they might be feeling these things. And then of course, sometimes thoughts of wanting to die is another sign of depression.
I didn't realize the pain aspect, so there's no known correlation of what's causing this pain. It's mental?
It's mental. The pain is real, but they can't find a physical reason for it. Yeah. And often headaches is a good sign of that there might be some depressive symptoms going on.
So the thought process here is what? Why, if there's no physical reason for this?
Well, I think that our mind just does funny things. The mind-body connection is stronger than we might think. I found out an interesting fact the other day. Do you know there's more serotonin in your stomach than in your brain?
Wow.
Now, serotonin is the biochemical that we often think of as the mood enhancer in our mind and brain. And that's why a lot of times when you suffer a loss or something's going on wrong, your gut starts to hurt. And it may be the serotonin it's reacting to the stress as well. So that's why somatic pain is a good indicator of some possible depressive symptoms.
That might also be why they talk about some foods being good mood foods and others not.
Mm-hmm. Both maybe for the stomach and for just for the mind, because they do produce the right number of biochemicals to help your mind and brain work effectively.
And how are you defining adolescence? What ages?
Ages 13 to 25. Yeah. Adolescence is a lot longer than it used to be.
Why is that?
I just think from a social cultural standpoint, we've set it up that way. I mean, in 1850, adolescence was pretty much done by age 17 or 18. Now, we have an extended adolescence, mostly due to college and other advanced learning opportunities for our children.
Isn't that interesting? So people develop their brains quicker in 1850 than they do now?
No, I think it was just a matter of what needed to be done around the farm. Kids went to work. Oftentimes by what? 9th grade, 14, 15.
They got married at 16 or something.
Right, exactly. Their brains weren't really technically done developing, but they were onto the business of adulthood a lot sooner.
And I would assume that varies person to person when your brain is fully developed, but what's the average?
Well, the average is women tend to mature by age 20, men maybe by 23, but there's still some brain development both for men and women up until about the ages of 22, 23 years of age.
And that's it? Then we start going backwards?
Well, your brain isn't developing anymore, but that doesn't mean that you can't continue to enhance your cognitive abilities in various ways. Yeah, that's still open to debate. Crystallized information continues to really grow as you get older. You can continue to grow more. You can learn and learn more. But I just learned an interesting fact. Air traffic controllers are forced to resign at age 56 just because there is some cognitive decline, and you need to have a very sharp mind. After age 56, they determine that's the cutoff age for air traffic controller.
Isn't that interesting? I'm 56. If I was an air traffic controller, I could retire.
You could retire. Unfortunately,
I'm not.
You're not.
An air traffic controller. But I do understand where they're coming from there, because at 56, I don't remember the things like I used to.
Right. We're not quite as sharp.
Which my mom's theory was, your brain's like a computer. There's only so much hard drive.
Mm-hmm. Mm-hmm.
And so you can't fit all the stuff in when you get into your 60s, 70s, as you get older.
Right. There's a lot of new research on that. I haven't read a lot on this, but ways to keep our minds flexible. You can actually see, I can't remember the name of the website where you can purchase these brain games to keep
Oh,
your
sure.
mind more
Yeah,
flexible.
I've seen that
So that's
too.
a new area of research and development.
Yeah. Well,
I'm not so familiar with that.
And she did crosswords and word finds and that sort of thing into her, 80s. So
Exactly, right.
it's probably a good thing.
Didn't hurt.
Probably a good thing. Getting back to adolescent depression,
Mm-hmm.
as I noted before he hit the airwaves, I was telling Eric that I did do a little reading of some of the journals in his profession, which has some interesting jargon in it,
Mm-hmm.
and just gleaned some statistics. This is from the Journal of Affective Disorders, February 2015 issue. It says mental illness and obesity in pediatric population. They studied 244 youth ages 8 to 17 at the time of entry into a weight management program, and they said that their term here, depression, was common at 36.4%.
That's a high rate of depression. I mean, that's higher than at 36%, that's probably double of what the normal population is. 1 in 5 adolescents will experience a depression during their adolescent years. 1 in 5. Think about that. That's 20%. So at 36%, basically they're saying if you're obese, your rate of depression your chances of being depressed are almost double.
And in this, when I think back to my adolescence, in this population, that makes some sense. You know what I'm saying? Because
Mm-hmm.
there's so much peer pressure at that age.
Right. Now, unfortunately, I disagree with you a little bit. When you and I were growing up, because you and I are contemporaries, our chances of actually being depressed were less. When you and I were growing up, the first age of onset for a major depressive episode was probably 55 years of age.
Wow.
Now, it's 22 to 44. They're the first people to be depressed. Unfortunately, the World Health Organization is predicting that adolescent depression will overtake the 22 to 44-year-olds in the next 5 to 10 years.
Do we know why?
There's lots of factors. I think media is playing a huge part in that. Not this kind of media, but social media is probably having a big impact on
that.
it.
Facebook, Twitter,
Yeah, right.
Instagram, all that stuff.
Right, commercials. So I don't think we've really nailed down exactly what those causes are. But 1 in 5. So, that's a lot of people. One third of those who have major depression will have that occurrence before age of 16. Now the good news is, 80 to 90% of kids who have a major depressive episode will recover within 7 to 11 months. But the last 10 to 20%, often that depression will persist. That's why it's critical that we get them help. So it's just critical that if kids are having a depressive issue, 1 or 2 therapeutic sessions or none are not going to help them recover more quickly.
According to the Journal of American Academy of Child and Adolescent Psychology, January 2015 issue, it says urgent need to improve screening and treatment access for adolescents. There's an urgent need for that.
Right. I don't think we often do a good job of finding ways to get the kids the help they need. I saw a statistic where for every kid that goes into, let's say 10 kids go in for a hospitalization or a suicide attempt, only 47% will actually come out and do some more outpatient counseling. Only 47%. The other 53 just kind of move on. But that's not what you're talking about. You're talking about ways to screen kids.
Right.
Now, I would say the schools in Minnesota, or at least around here, are doing a little better job of doing that. We have clinical social workers in the schools who are, I talked to a colleague, he's doing a suicidal evaluation once a week, 1 or 2 a week he's evaluating whether they need to be hospitalized. Now, only 1 in 20 of those kids that he's evaluating actually go to the hospital, but there's one every week, 1 or 2 every week that he's actually evaluating for suicidal ideation and whether their level of suicidal ideation is needed, is high enough that it actually has to require a hospitalization. So schools are doing a better job, but I think we can always be on the lookout.
They did a national survey of 10,123 adolescents aged 13 to 18 in this study. And one parent was also asked to complete a questionnaire, which I found interesting because according to another journal, the Current Opinion in Psychology, Volume 4, August 2015, they say that there is a correlation between a parent that has depression and adolescents getting depression.
Right. This is one of the things that's so concerning about the World Health Organization finding that the highest number of people being depressed at this time are ages 22 to 44, is because those are the people who are, they're raising their children during that time. And if you are depressed, your chances of your child being depressed increase by 3 to 6%. And so yeah, there is a correlation between a depressed parent and a depressed child.
What was noted in the Journal of Affective Disorders, March 2015 issue, they say here 40% of offspring of depressed parents develop depressive disorders themselves by early adulthood.
Right, and so this points to another theory about the fact that the depressed parent isn't really running life or leading their life in a way that is effective, and that they're not able to teach the appropriate assertiveness skills, or expressing emotions effectively, interpersonally, not interacting effectively with others, and so that's being modeled to the child. So just from a learning standpoint, the child isn't learning the skills that are needed to be an effective person in our society.
Yeah, one of the things that the little bit of reading I've done on this, one of the things they pointed out was there's a bit of a role reversal in the family, that maybe the child has to be the parent.
Right, and the term for that is parentification. And often these kids look really good. In my own caseloads that I've seen over the years, is these kids look really put together until they're about 15 years of age. And then the wheels kind of come off. They tend to become very rebellious and become more depressed.
There may be alcoholism, criminal issues. Those are some of the things that they cited in here.
Yeah, those kinds of things happen because that pseudo-maturity, I think, gives them the false belief that they can go out and conquer the world because they've been taking care of their parent, but I don't think it doesn't really work that way.
Yeah.
So those are interesting statistics. I like that. That's an interesting study.
Yeah. Eric Lundin is a psychologist with Rice County Social Services. Our guest this morning on AM Minnesota, we're talking about adolescent depression, and that's one of the reasons why I brought up grandparents earlier. If there's that much prevalence of a parent being depressed and then the adolescent, you need another set of eyes.
Right, another set of eyes who can. This is always tricky, though, about grandparents giving parental advice.
Well, that's true. Yeah, you're right.
Yeah, that's tough. I think what the role the grandparent can play is to be in relationship with those kids as much as possible, and finding ways where where the child in that situation with the grandparent isn't parentified, but can really play out that role of being a child.
A sounding board.
Yeah, a sounding board, a support person, those kinds of things to help support the child and their own children who might be depressed.
Yeah, well, they probably need to ask those difficult questions of their own kids,
right.
even as adults, right?
Right, because there are suicide predictors out there. You have to remember that the #1 suicide predictor is not depression. That's another misnomer. The one is hopelessness. When a child becomes hopeless and they don't feel any hope for the future, that's when, especially when combined with impulse control problems.
Isn't that depression, though?
Well, there's depression there, but you can be depressed and not hopeless. But when you have depression with hopelessness and impulse control problems, along with chemical dependency concerns, those children are most at risk. Another one is boys and girls who are identified as gay, bisexual, or transgender. their rate of suicide attempts are 7 times those of normal adolescents. So think about the higher risk for children who are identifying as gay or bisexual or transgender.
You said 7 times?
7 times higher. So I think another thing you have to recognize is that if a child does have a suicide attempt, 10% of those adolescents will make another suicide attempt within 3 months. So just because you think the crisis is over, it's really not. They'll actually find 10% of those are at risk for another attempt within 3 months. And 20% will reattempt within 2 to 3 years. So we have to be on the lookout for these kids because although depression will remit, the chances of it reoccurring for children who've already been depressed or adults is high. And so we have to really be on the lookout for those children who have had an attempt. One more thing, I found that children who have made an attempt, who have made several attempts of suicide, their risk of having a more lethal means goes up with each attempt. I found that was something I learned. I didn't realize that each attempt, the suicide lethality goes up.
I told you about a recent case of an adolescent suicide where a young woman jumped off a bridge.
Mm-hmm.
And according to parents, friends, people close to this person, there were no indications whatsoever this was going to happen.
Well, this is another thing that I think is so frustrating for people who deal with suicidal people, is that there is an impulsivity about it that's really fairly quick-minded. From the time that a person decides they're going to do it to the time they do it, it's like 10 minutes. So now, were there signs leading up to it? People will say, well, no, there wasn't. But do we know that internally she wasn't feeling extremely hopeless? Was she withdrawn? Was she feeling a lot of anger? Did she, again, feel hopeless, trapped, with some anxiety? Did she feel a sense of purposelessness? These are all indicators of a potential suicide if a lot of those indicators are there. And so we don't know that, but oftentimes if you were to delve into it more, those had to have been there.
According to these people, she never shared any of these feelings with them.
Right. That's another
close
difficult.
Friends, parents.
Right. That's another
siblings.
Difficult thing. That's what made her probably more at risk, was that she internalized all this stuff, and no one was able to reach her. I think it's easy to blame people when someone has completed a suicide, and surviving a suicide can be very difficult. Meaning the people who are left behind, they're often left with a lot of guilt and shame. And like I said, people who do this often, the window of opportunity to catch them when they've actually made their choice is very small.
I had an aunt who suffered a major depression
Mm-hmm.
when her last child left home.
Mm-hmm.
Because she lived through her kids, you know what I'm saying?
Right.
And she was put on depression medication the rest of her life. She was on this depression medication.
Right.
Which is why I was going to ask you if depression can be cured.
Well, yes, I think it can be. But you have to really work hard at it. Exercise, diet, socialization, having friends, making sure that you're connecting with friends, dealing with vulnerable times in your life like your aunt, figuring out, that's a major transition oftentimes for people. And so, but you have to really work at it when those times come on and examine what's going on with your life, finding a new purpose, these kinds of things. Other times, use the antidepressant. Why not? It can alleviate a lot of symptoms so that you can then move on with these things that I'm talking about, such as socialization, exercise, sleep, Those things come a lot easier with the antidepressant.
And thank heavens those have improved over the years too, because when she first took these, there was obvious signs that she was on
Very,
them.
very big side effects probably when your aunt took them.
Yeah. I mean, we're talking back in the dark ages.
Yes, yep. Those were what they call tricyclic antidepressants. Still used to some degree now, but we have better ones now. We've moved on to like second and third generation antidepressants. They aren't always the answer, but when they're needed, they do help.
So that's obviously an option among adolescents too, or do you try to refrain from?
Well, there's been a lot of debate about that, and I think in my own opinion, we may have overreacted to what we call the black box warnings related to potential suicides of children who might take antidepressants. Studies showed that between 1991 and 2005, the use of antidepressants actually lowered the number of suicides in America each year because they were giving antidepressants. And when the black box warnings came out in 2005, suicide rates then began going up again because we quit giving the antidepressants to the children.
You know, this show just ran out of time.
Hey, we're done. It was great today. Thanks, Gordy.
And I even had some more questions here that I didn't get answered, which is usually the case.
Mm-hmm.
But if you had one piece of advice to give people, what would it be?
The piece I would give is that if you have a concern about a child in your life, don't be afraid to ask the question, are you suicidal? Have you thought about killing yourself? It will not increase the risk, and you may save a life.
Hear that? It will not increase the risk.
No, it will not.
Thanks, Eric. It's always a joy to have you on the show.
Thanks, Gordy, for fitting me in. I know your schedule's busy.
I appreciate it very much. Eric Lundin, psychologist from Rice County Social Services, with us today.